Hi, my name's Kelly. I'm a CBT therapist and psychologist, and today I want to talk to you about values. So, values are something that we use in CBT, and it's often used in acceptance and commitment therapy as well. So, how we use it in CBT, we often use it when we are working with people with depression. But it can be a really good tool when people are feeling that they're lacking direction in their life, or that they are struggling to know maybe what they really want, or as I said, they're feeling low and they're feeling that they're not getting what they want out of their life. So there is about 10 values that researchers looked and said that a lot of people have in their life. So these are different areas that people can have values in. So you have family, you have parenting, if that's applicable to now in the future. You have different sort of relationships, so whether that is romantic, whether that is social, or whether that is more intimate relationships, however you and your client really like to term it. Then you have looking at your recreation, so your leisure activities. Then you have your social activities, or kind of your social side, so thinking about your friendships and your social life. And you have got career and employment. You've got community, so that wider community around you. So thinking about maybe community groups or things like that are just kind of outside of maybe your normal social circle, but still within some sense of community. Then there's the idea of education and growth and being able to work within that. Like, what do you want to achieve? Do you want to learn more things? How do you want to grow? Then you have looking at spirituality. And with spirituality, it's not just to do with religion, it's just that sense of something that is bigger than you. So there are various questions that you can ask people. So what do they want their social life to look like? What sort of friend do they want to be? And this can be done by just getting people to have like one word kind of descriptive answers, so maybe kind or supportive. Or it could be something that's more in a sentence, so I want to be a supportive friend. And think about, okay, what does a supportive friend look like? But so first of all, you'd go through all the values, you'd get the clients to answer those questions and to come up with either the one word, or you can have the one word but change them into sentences. Because when you change them into sentences, you can operationalize them. So what I mean by that is that you can then work with that. You can then match activities to those values. But before you get to that part, you'd want to get the client to rank how important are those values to them. So you could get it just on a 0 to 10. So how important is it that you are a supportive friend? Or how important is it that you finish your degree? Whatever it may be, whatever that value is for them. So you get them how important it is, and then how much success are they having with living in line with that value right now. And there often may be a discrepancy between the two. So it could be something that they deem is really, really important. It could be something that they haven't got much success in doing. And then what you want to do, once you've kind of got all of those ratings and all of those rankings, that's when you go back to that operationalization part that I mentioned. So that is when you really want to be able to get people to link in activities with their values. So if we go back to the supportive friend, it could be that they make an effort to call a friend once a week. It could be that they make an effort to see a group of their friends once a month. Whatever it is, you want to translate that value into an activity. And then you can look at maybe scheduling those activities. And that's what we would maybe call activity scheduling. So you get the client to think, okay, what's reasonable for them? What could they reasonably do within a week or 2 weeks, however long it is between the sessions? And just get them to pop that in a diary and getting them to be accountable to it. So on a Friday, I will make plans with a friend, and you want to break it down. So say if you had of going out with a friend, seeing a friend or group of friends once a month, you're not going to do something like that. There's going to be some element of planning. So the first week may be about saying it to your friends and arranging a date. Then it could be about researching where you're going to go, then booking it. So you can break it down, and that's particularly important for clients who experience depression or low mood, because they may be lacking in that motivation or the belief that they can actually do it and achieve it. So by breaking down those activities, you're going to make the client more likely to do it. It's going to boost their mood, it's going to boost their motivation, and they're more likely to do it. And following on from that, one thing that I would say is that when you are working on helping a client to improve their mood will never change before they do an activity, but it will more than likely change after. So it's getting that client to believe in you. That's what I mean, break it down really, really small and getting them to try it, to push through it, and then to see how they feel after. And that is really simply how you can use values in CBT or in psychology. And it's a really great way to get a client to just evaluate where they are in their life and where they want to be, and help them to act in line with their values. And the idea is when people act in line with their values, they feel happier, they feel more fulfilled, they feel more motivated. And it can be something that once you've done it with a client, they know what to do. They can go back to their values. In a year or so's time, if they want to reevaluate their values, things change, and that's completely fine. But you can do some work on core values, but that's something a little different. These are kind of more of the values that can change. You have some values that may stay, so you always may want to be a supportive friend, but there may be some that adapt. So when we're thinking about the career or the education values, they could change as your life changes. And even the friends one, it may be that you want to meet friends once a week or a couple of times a week when you're younger, but as you get older, it may be that you meet them once a month. And that's fine, because if that value of being a supportive friend is still there, you just adjust the activities to suit your life. So that's what I mean. It's a great exercise, and it's a great, even do it on yourself. See how it feels, see what your values are, see if you're acting in line with your values. Are you doing things daily or weekly or monthly that are upholding those, or do you need to do some reevaluation? But it is a key skill, and it's a great skill that you can use. I've got loads of other videos on my YouTube talking about all things CBT and psychology, so check them out, and I hope you find them helpful. Thank you.